'Tis the season to shine with H&M. Discover the holiday collection and find fashionable pieces for your wardrobe or for under the tree. Get inspired and dazzle with this year's glam. From tuxedo styles, bow detailed pieces, impressive prints, and more. From unforgettable looks to unforgettable gifts. With fashion finds to home decor, find it all at H&M. Treat your loved ones and yourself this season. Shop in-store or at hm.com.
This episode is brought to you by Shopify. Selling a little or a lot? Do your thing however you cha-ching with Shopify, the global commerce platform that helps you sell at every stage of your business. Shopify helps you turn browsers into buyers with the internet's best converting checkout. 36% better on average compared to other leading commerce platforms. Get a $1 per month trial period at shopify.com/offer23.
'Tis the season to shine with H&M. Discover the holiday collection and find fashionable pieces for your wardrobe or for under the tree. Get inspired and dazzle with this year's glam. From tuxedo styles, bow detailed pieces, impressive prints, and more. From unforgettable looks to unforgettable gifts. With fashion finds to home decor, find it all at H&M. Treat your loved ones and yourself this season. Shop in-store or at hm.com.
Ryan Reynolds here from Mint Mobile. Not only have I been the owner of Mint Mobile for the last few years, I've also been a customer. I don't know if you knew this, but anyone can get the same premium wireless for $15 a month plan that I've been enjoying. It's not just for celebrities, so do like I did and have one of your assistants switch you to Mint Mobile today. I'm told it's super easy to do at mintmobile.com/switch.
New activation and upfront payment for 3-month plan required. Taxes and fees extra. Additional restrictions apply. See mintmobile.com for full terms.
'Tis the season to shine with H&M. Discover the holiday collection and find fashionable pieces for your wardrobe or for under the tree. Get inspired and dazzle with this year's glam. From tuxedo styles, bow detailed pieces, impressive prints, and more. From unforgettable looks to unforgettable gifts. With fashion finds to home decor, find it all at H&M. Treat your loved ones and yourself this season. Shop in-store or at hm.com.
Hey, I'm Ryan Reynolds, owner of Mint Mobile, with a message for everyone paying big wireless way too much. Please, for the love of everything good in this world, stop. With Mint, you can get premium wireless for just $15 a month. Of course, if you enjoy overpaying, no judgments, but that's weird. Okay, one judgment. Anyway, give it a try at mintmobile.com/switch.
New activation and upfront payment for 3-month plan required. Taxes and fees extra. Additional restrictions apply. See mintmobile.com for full terms.
By not properly intervening, we are creating a scenario where those illnesses are going to run rampant and just progress quickly. But then also we're being put on tons of medications that are completely flattening our affect and also causing side effects for us. So, I mean, these medications aren't benign, but we're so willing to take them and dole them out. But everyone seems to be afraid of hormones unjustifiably.
Hey girl, imagine a life where you feel supported, connected, and understood. I get it. Being a mom is hard, especially when you're spinning so many plates. We exhaust ourselves trying to create the perfect life for our family. You deserve to enjoy your family without the stress perfectionism brings. On this podcast, I provide practical and relatable life experiences. I teach women quick and easy to use strategies to help them reclaim their identity, reignite their marriage, and enjoy their children. If you're ready to be challenged, then pull up a chair, grab pen and paper, because it's about to go down. I'm Veronica Cisneros, a licensed marriage and family therapist, and this is the Empowered and Unapologetic Podcast. Hello, welcome to Empowered and Unapologetic. I'm your host, Veronica Cisneros. Today's guest is a dynamic professional on a mission to change the face of women's health and wellness. Ladies, grab your pen and paper because you are definitely going to want to take notes, because she has more than 25 years of experience in the medical field, both on the pharmaceutical side and in clinical practice. And she is an internationally recognized authority on women's hormonal health. She understands the range of health issues women face and is enthusiastic about educating patients on the realities of the risk factors of hormonal health imbalances. So please help me by welcoming Dr. Angela DeRosa. Hey.
Hey, Veronica. Thank you so much for that just enthusiastic, warm welcome. I really appreciate it.
Absolutely. So I'm not going to lie. I have a pen and paper right next to me because I'm totally going to be taking notes. So one of the biggest issues I find most women have is we don't ever take time for ourselves. And very rarely do we go to the doctors. Very rarely do we maybe even go to dental visits. Our kids are on time. Our kids are, have their vaccinations, everything with regards to immunization is on point. However, when it comes to us, we tend, I don't want to say to fall back, but yeah, we tend to neglect our health.
Yeah, we deprioritize ourselves.
Absolutely. Mm-hmm. I'm not saying I speak from experience. I'm not saying that. I might have a sprained foot right now, but this isn't about me. This isn't about me. So what would you say? Well, before we even get into that, what got you into this field? What's your story?
This field very, very personally, because I always say in life, as I'm sure you're aware with your own personal journey and then talking to thousands of women, I'm sure, is that it's often that personal crisis or something that can lead to a mission. And mine came in the form of not only a personal, but a professional crisis as well. When I was in medical school in my residency in my mid-20s, I started experiencing perimenopausal symptomology of hot flashes, night sweats, depression, weight gain, mood swings, all the typical symptoms. And it wasn't until hindsight 2020 where we had an opportunity to look back, but I was experiencing perimenopausal symptoms and went through full-blown menopause at the age of 35. So I was one of those 10% of women who had premature ovarian failure. But when you look back at the experience, however, is that I was seeking help from my colleagues and medical professionals. And I was patronized and demeaned and treated with like, oh, there, sweetheart, it's all in your head nonsense. Or you're in residency in medical school, you must be under stress and try to work through it. Go on a date night, eat better, exercise, all the typical nonsense we tell patients that really have little effect. And what I really needed, though, at the time was hormones. And that was what helped me transition through perimenopause and manage through all the complications that were occurring. And I'm sure women who are listening to this program, they get this all the time when they finally do get brave enough, or if they take the time for themselves and they go in to talk to their clinicians about what they're experiencing. If a man were to walk in with the same symptomology, they would be taken very seriously and a full workup would begin. We are basically patted on the head and said, there, sweetheart, here's your antidepressant, and sent on our way. Yeah. So it became a mission of mine not only to help myself get better, and I've experimented and done more damage in the name of science, learning all about this over the last 25 years, but also to ensure that not one woman who came to see me would ever be treated like that again, because women overall know their bodies. They know when something's wrong, and they almost have a BS detector when they know they're not getting the answers they need. And we get dismissed all the time, and it gets frustrating because they don't know where to turn. And oftentimes they look at the internet or their girlfriends, and the profession's not helping them. Mm-hmm.
So you wrote a book, How Your Doctor is Slowly Killing You, a Women's Health Survival Guide. All right. So
didn't win any friends with that one in my profession.
So for me, I'm actually looking for a new doctor because I feel like, being in the military, we moved a lot. And so I had to switch doctors, and I was trying to make sure, I'd always try to make sure like, okay, make sure, you have to get a mammogram, or you have to, there was a lump. And so it's something that we're keeping track of every single year. And I've had it forever, but just wanting to make sure it's not growing and things like that. And then me making this mental note because I would switch a doctor, or I had a fatty liver, and I'm not like tequila shots all day, but I have a fatty liver, and I don't even take medication, but I still have a fatty liver. And then I also have a polyp in my gallbladder. So I'm saying all of these things because I'm keeping a personal mental note when I switch doctors of, hey, here's what I need to make sure you know of, so you can write up a report, write up a referral, so I can continue ensuring that nothing's growing or nothing's changing.
Mm-hmm.
However, I'm finding myself really stuck with finding a health professional who actually, quite frankly, gives a shit. I went in for sprained ankle, and it's like, okay, well, I'll get you that referral, and then it never happens. So my question to you is, what's the process to find a doctor that will meet our needs?
Yeah. Well, and you bring up one of the greatest failures of our medical profession now. I mean, even the last 20 years, I've noticed a slow, steady decline and kind of segregation. We're not there. We used to have the old family physician who looked at all of our needs.
Everything.
Now you get referred here, you get referred there.
Yes.
Nobody in medical professions. When I moved to Phoenix, I trained in Chicago, and we always spoke to one another. If I had one of their patients, I would call them and we'd talk about it. That doesn't happen anymore. So you have segregation of specialties. You have referrals going out. The physicians and specialists aren't communicating. So patients get divvied into body parts and nobody's looking at a big picture. Yeah. And one of the things that I've learned overall, in particular, when you start to deal with perimenopause and menopause and hormonal imbalances in general, you often need someone to look at the overall picture, because you can have those hormone deficiencies be root drivers for a lot of different things. Mm-hmm. But if let's say I go talk to you because I'm depressed, but that could be a testosterone deficiency symptom, or I'm going to see another specialist for bone loss because and that could be a deficiency of estrogen and testosterone, or I'm starting to have hot flashes or mood swings or vaginal dryness, and you start going to see OB-GYN, and next thing you know, you got 5 specialists, or you're having palpitations and you go see a cardiologist for a stress test and all that. And nobody's putting together the big picture. So it becomes really important to have that advocate, someone who is going to look at that big picture. And notoriously, your family physician or your internist is supposed to be that person, but even they have started to fail in that regard. But overall, they are really good at looking at conventional medical things. Let's make sure you got your immunizations. Let's make sure you had your stress test, your mammogram, all those different things. But I have found that the majority of your traditional internists, family practice, or doctors, and women's and OB-GYNs in particular, they dismiss the role of hormones. They're not really giving them a serious thought in symptom complexes. Yeah. So they're not even on their radar or consideration. But the other thing that's interesting is medicine, as we stand now, is very illness-based, meaning we wait till people get sick and then we treat, and we don't intervene before that. So I tell my patients, so for instance, let's say an endocrinologist, they're going to look at blood tests, and you're going in there for all these hypothyroid symptoms. And you clearly have the symptom complex. You're physically showing hypothyroidism, but your one lab test says you're okay per reference range. The endocrinologist may dismiss you and wait till you're really sick with that low thyroid before they intervene. Whereas an integrative specialist, a functional medicine, or someone like myself, we're going to intervene when things are slowing down before you take on the full board illness. So it becomes almost a philosophy of thought. So when you're looking for doctors who can help you with hormonal care or an overall broader picture, you're starting to see more integrative specialists, functional medicine. There's a lot of folks who still use that anti-aging term, which I really don't like. It's about restoring and creating optimal health, and not allowing us to get to the point where we're so sick, where traditional medicine is then largely intervening. So when you seek out your doctors, first and foremost, like I said, trust your gut and trust your instinct. If you're going in to talk to someone and they're disregarding you or not even talking to you, I mean, that's a problem. And the book actually goes and outlines different red flags. If someone says this to you, you probably need to walk out the door, or things to look for in clinicians. But you can't count on your traditional OB-GYN in most cases to manage your hormones and understand your hormones, because they're not going to be specialists in there. They're surgeons, they deliver babies, they get basic understanding of hormones just like your general doctor. So it becomes important to know what you're really looking for. So if you're looking for a hormone specialist, go find that person. Don't trust your traditional doctor to be that person, because oftentimes they're not going to be open to that, or they may give you some bad information, which is even worse than no information.
So for primary care manager, for your primary doctor, who am I looking for? Because I don't know. I'm thinking, I'm looking at who accepts my insurance, and it's like, okay, well, they seem cool.
Yeah.
You know what I mean?
Well, and not to say that there's tons of wonderful family practice doctors, and they can manage a lot of your basic needs. But guess where, and that may be where you would, if you have someone who can manage like your pap smears and all those basic needs, that's wonderful. But I would make sure that they're open, if you're struggling with hormone deficiency symptoms or problems, that they're open to hormone therapy, that they're willing to dialogue with someone, let's say like myself. I'm in a unique position because I'm an internist and a hormone specialist, so I could manage the whole breadth of things. But if you have someone you really like or trust, or you found someone who can manage your basic care needs, that's wonderful if you can have a good relationship to them. But just be cognizant that your general person is not going to always have enough information to properly advise and guide you when it comes to hormone management. And that's where you would seek out someone to kind of layer on top of that.
Okay. So you would have your primary doctor, and then you would also have a hormonal specialist. So you would have both.
Right.
Okay.
Or in some cases, there's a lot of great functional medicine doctors who can take on that, are integrative specialists. Or like in my clinic, we manage both. So there are a group of us that are able to do preventative care and hormonal care, but in the basic constraints of the overall, and what's most likely to happen though is if you can find a really good primary that's at least open to having you work with a hormone specialist, that's the ideal scenario.
Okay. And then so when we go in for our first appointment, what are some red flags?
When they say that they're there, sweetheart, it's all in your head. So first off, if they have their hand on the door and ready to leave the second they walk in the room, if they're not engaging in eye contact, if they don't even give you a chance to tell your story, so if they're basically interrupting you right off the bat, if they disregard your symptoms and don't make you feel understood, or that they're apathetic to your needs, if they're immediately suggesting antidepressants for any kind of symptoms that may be broader and bigger than that. So I'm always that's really been one of the alarming things to me, is when men walk in with symptom complexes of testosterone deficiency, low libido, lack of energy, lack of endurance, lack of mental acuity. That's taken very seriously by doctors. They'll work them up really quickly, or if they walk in with cardiovascular symptoms, they'll end up getting stress tests and all the things quickly. A woman walks in with similar things, they got, okay, you need to see a psychologist or an antidepressant, or, and I've seen this happen all the time, where a lot of women walk in with cardiovascular, kind of more vague symptomology, and they're totally disregarded until they have a heart attack. So you have to advocate for yourself, and really, if you know something's wrong, push till you get the right answers, because you may be dismissed. So
I agree with you. I see that in the clinical field with regards to patients. They'll come in and they'll tell me, I'm having heart palpitations. And I can automatically say, okay, well, this person's suffering from anxiety, or my stomach's hurting, also could be anxiety related. It's difficult for me to get up out of bed. Okay, now we're looking at possible depression, lack of interest, possible depression. And right away, it's the first question I often ask is, when was the last time you had a physical? Because I can pass out diagnoses like no tomorrow, as I'm sure any other, any doctor can as well. However, if they have not had a physical, then it might be something that's not, it's not mental health related. It might be something that really needs to be addressed.
And here's what's really interesting too. When you start to think about things that women are commonly diagnosed with, depression, fibromyalgia. Those two things we get labeled with all the time. But as women move through their 30s and start to move through perimenopause, we lose our testosterone, which is actually our most abundant hormone. And testosterone deficiency leads to a serotonin imbalance, which will lead to new onset mood disorders and anxiety, panic, So if they've traditionally been able to cope and manage, and all of a sudden there's an abrupt change in their 30s and early 40s, it's most likely due to testosterone deficiency. And testosterone deficiency, as I said, again, it's our most abundant hormone, but it also can cause muscle aches and pains. It can cause sleep disturbances. It can cause, as I said, the depression. So then all of a sudden now they're thinking, okay, you got muscle aches and pains, you got depression, your sleep, so you must have fibromyalgia.
Yeah.
And then they get labeled, and then they're off on this bad path. But what's also interesting is testosterone, since it affects serotonin so dramatically, as you're probably well aware and knowing what you know, is that only 5% of our serotonin is in our brain. The other 95% of our receptors are in our gut. So you start to see IBS or IBD type symptomology associated with it, which only confounds and supports the diagnosis of fibromyalgia when it's most likely a testosterone deficiency and or coupled with thyroid imbalances and or vitamin D or all three.
Yeah. What are some questions you could give us to ask our doctors when we're going in for a first-time visit?
Mm-hmm. Well, I mean, I think you need to know what your goal is first and foremost with that visit. If you're going just for a basic physical exam and you want to get caught up in all your preventative things, I mean, I think you would just say, you know what, I'm from my age and on my family risks, what do we need to be looking at for preventative standpoints? Are there things that we missing that we need to catch up on? If you're having the symptoms of potential hormonal deficiencies, or you're or maybe thyroid, testosterone, estrogen, or any of those complexes, or something's just not right, I would also ask, is it possible to evaluate my hormones? And are you a specialist in that area where you're not going to just look at reference labs? Because again, if you don't know a lot about hormones, you may misinterpret those reference ranges inappropriately and give the patient a false answer of you're fine. So I would want them to know what is their background and experience in hormones. Are they comfortable ordering them and treating appropriately? And if not, would they be comfortable working with someone who does and collaborating so that you can get the best care that you deserve?
I'm totally taking notes, by the way. Sorry, ladies. It went from you to just me.
And it's usually all about me. I don't know about this.
No, this is great. Okay, so I'm asking my doctor if they're open to what's their background in working with hormones. Do they feel comfortable with providing, the results of an assessment? Okay.
And are they going to be just adhering to traditional? I mean, the key is to try to find out, is that person really going through the traditional dogma of, hormones cause breast cancer, or which is not true when properly done, or that you can almost get a sense that they have a stigma toward it, or if they're just going to manage. And if they just say, okay, I can manage your estrogen and we'll get you on progesterone, but they make no mention of testosterone in women, they don't know enough. So they should have an acute awareness that testosterone is our most abundant hormone. So if you start going down that path and all they're suggesting is estrogen and progesterone, there's definitely a problem and an outage.
Okay. And you just confirmed that. I'm going to put down my notepad and paper and push pause on this recording every so often. Just take notes from there, because I don't want to limit the amount of information you're providing all of us. So I'm just going to ask a whole bunch of questions. Ladies, get ready.
And a lot of this is all in the book too. So
yes,
you don't have to feverishly take notes. So
I'm very thankful for that. So point blank, how is our doctor slowly killing us?
Well, and I used that sentence flippantly to some degree because I was trying to draw attention to it. But what it really means, and this is, my colleagues weren't necessarily happy about it, but I tried to explain to them, first off, we always have to have our own sense of humor about ourselves and our limitations. But it's not that doctors intend to slowly kill women, but because of ignorance or misinformation or lack of understanding, they are slowly killing women. Because if you look at it this way, so if I present, just like I did when I was in my mid-20s, with hot flashes, night sweats, depression, anxiety, sleep disturbances, my cholesterol was all out of whack. I was having heart palpitations due to estrogen deficiency. So all of these symptoms actually relate back to one of those deficiencies. And but instead of giving me, say, estrogen and testosterone and progesterone and thyroid, which is what my body needed and it was screaming for, I was put on lipid medication an antidepressant, a beta blocker to slow down my heart, and a sleeping pill. And it was like by the time I was 30 years old, I was on 4 to 6 medications to control symptoms. And those medications aren't without side effects.
Yeah.
And what you're also is missing the opportunity to intervene and create optimal health, because if you don't have optimal balance of those hormones, you're at risk for cancer development. You're at risk of developing cardiovascular disease, diabetes, osteoporosis, and all of these other chronic illnesses, cognitive dementias. I mean, the list goes on and on and on, which will kill women prematurely. Yeah. And so by not properly intervening, we are creating a scenario where those illnesses are going to run rampant and just progress quickly. But then also we're being put on tons of medications that are completely flattening our affect and also causing side effects for us. So I can't tell you the number of times I've heard horror stories of women who have taken Ambien just to sleep when they need estrogen. And they've driven, a colleague of mine got in a car with her daughter and got arrested and lost her license because she was sleepwalking in the middle of the night with Ambien. So, these medications aren't benign, but we're so willing to take them and dole them out. But everyone seems to be afraid of hormones unjustifiably.
Okay. Here's a question. How often should we see our doctor as women? And what should we be seen for? So I'm under the impression once a year you get your physical, and that's about it. I don't know if that's 100%, if I'm on the right track.
Yeah, I think it's really kind of age dependent and risk dependent. So I hate to overgeneralize. I think it's always nice to have your annual physicals and make sure everything's up to date. I think that's a good overall benchmark. But there may be times where you need to be seen more often. So if I have a young person who's in their 20s and they just need to come in for their pap smears, I check in with them, make sure there's nothing going on, check their blood pressure. That's going to be a very different person than, say, if I have a 60-year-old with a lot of chronic diseases and medical management, where I may have to see them every month, every 3 months, every 6 months. But your average patient, so let's say someone in your females, 40s and 50s, who have very little medical problems, a minimum of yearly. But if we're starting to intervene with hormonal management, in the first year, I'm seeing them a month after I see them, and then every 3 months, and then every 6 months is my target, just to manage their hormones properly. But for your preventative maintenance, unless there's something compelling in your family history, I think yearly is appropriate.
Okay. Yeah. Most of our audience is in that range from 35 to about 45 years old.
So when things start to go awry, right? Because most 90% of women are going to start to show testosterone deficiency symptoms mid-30s, and then followed by estrogen deficiency symptoms in their 40s. And the second a woman has a hot flash, she's already testosterone deficient. And as I've alluded to, and I know you had a guest on previously that talked about menopause, but I don't know if she discussed the very much importance in the role of testosterone. But it's an often missed hormone for women because it's assumed we don't make any when it's actually more abundant than our estradiol.
What should we start taking vitamins right now? What should we do just to to preserve what we got?
Yeah. Well, and that's, again, it's interesting is that when I first started doing this 25 years ago or so, the average age of menopause was clearly in the 50s. Now I think it's more like mid 40s. And there's so many environmental things that I think are contributing to it. We've got antibiotics in our food. We've got radiation and environmental chemical exposures that God knows what's in our water. We've got cell phones, who knows what that implication is. And we eat poor diets. We don't exercise. We're doing all these things that are putting us at very poor health. So I think it starts with basics like getting good nutrition, getting proper exercise. You don't have to go run a marathon, but get out and move the body and get it used to doing that. And also a good multivitamin. Vitamin D is very essential. Even when you look at some of the COVID studies, when everyone's all worried about vitamin D, vitamin C, those are really helpful in keeping our immunities up, making sure you have proper calcium. So getting all those basic nutritional things met are very important. And one of the bigger things too, which is almost next to impossible, is stress reduction. Our bodies constantly think we have T-Rex chasing us every day and trying to find ways to not eliminate, because it's almost impossible to eliminate stress, but coping. You go to yoga, go to your spa with your girlfriends, check out. Find your ways to unplug and recharge. So that's important. But then also making sure you're getting your preventative things. Don't pass on them. I've seen women who've missed their mammograms for several years on end, and all of a sudden they're sitting there with a lump in their breast that could have been dealt with. Or get your colonoscopies. I mean, although they're a pain in the ass, literally and figuratively, you want to do it. And so making sure you're doing all those proper things. And then from my standpoint, I think hormones are such a root. It's basically the drivers of our engine in our body. They're drivers of so many cellular functions, making sure those are balanced, because when those become imbalanced, not only they feel like crap, but our bodies start to slowly disintegrate and age more rapidly. So I think it's important to make sure you keep those in balance.
Okay. All right. So making sure it sounds like just general, making sure that whoever our primary care manager, whoever our doctor is, that there is this good feeling, this good connection with, how receptive they are to our needs.
Absolutely. It's like a marriage. I think it's important. You have to have a good relationship, because it is a very important relationship. And if you have the wrong person in that role, it could be detrimental to your lifelong health.
All right. So let's say I'm on Google, right? And I'm looking in my area, girl, right? No, well, no, I would never, do not ever go on WebMD. Do not ever go on Google to read or to look up any of your symptoms. Do not do that, because you will self-diagnose yourself with everything. But where I was going, let's say I go on Google, right? And I'm trying to find a doctor. What should I type in there? Like, am I typing doctor in Temecula, or is there a certain name? Like, what would be your title?
Yeah. So if you type in my name, I mean, Dr. Hot Flash will come. I mean, that's obvious. But no, so you want to look for hormone specialist. So I would probably keyword in like hormone specialist, integrative medicine, functional medicine. So, I mean, if you're looking for just basic primary care, you can find a lot of those folks just by zip code and going to your local hospital systems. But if you're really looking at someone who wants to look at optimal health, I would be looking for those integrative functional hormonal specialists that can do that piece of it if you want to layer it on top of your trusted primary care, or to use them as your overall if they suggest in their profiles, once you do narrow it down, that they offer primary care services as well.
Okay. All right. So what was they called? Integrative,
restorative medicine.
Okay.
Optimal health, functional medicine, hormone specialist. I mean, all of those will generate some better results than just doctor in your area.
Okay. Ladies, are you ready for a new challenge? I've heard you. I know a good amount of you want to work on your marriage. However, before we start there, let's start by building up that confidence and self-worth. I'm going to help you reclaim your identity. Starting August 1st, I am running the Reclaim Your Identity Challenge. I will be live every single week in this group, teaching you skills on how to reclaim your identity, which will make you an exceptional mom, an exceptional wife, and a complete badass. For the entire month of August, we are all doing a challenge together. The lady who is the most interactive will be our winner and will receive a 1-hour private coaching call with me. This is a $300 value. How awesome is that, right? All you have to do is join my private free Facebook group. Go to facebook.com/groups/empowered and unapologetic. And be sure to invite your friends. Coaching calls will be every Wednesday at 2 p.m. Pacific Standard Time. You do not want to miss this. This will only happen for this month, and only the women in the private free Facebook group will have access. So don't let anybody else take your seat. I want to see you this Wednesday live. So I know for clinicians, if you're looking for a clinician, you can go on Psychology Today and you can read our bios and get a feel for who we are, what we specialize in, and what we don't specialize in, what our rates are. Is there anything like that for this doctor?
I don't think so. Not at all. But there are organizations. So like I work as a medical director for a compounding pharmacy called Belmar Pharma Solutions. It's one of the most well-reputed and nationally recognized in the country. And oftentimes we get patients who call into there saying, hey, is there somebody in my area that you would recommend? Because if they're compounding hormones or doing those kind of things, they're probably more open and more integrative. So oftentimes finding, like, you can reach out to Belmar Pharma Solutions. Even if you go to drhotflash.com, in back of my book, it has also ways of looking through different organizations to find doctors, like agemed.org is so agemed.org. They specialize in conferences for clinicians who do this kind of work, and they often have resources on how to find doctors. And good news is, I mean, today's day and age, even if someone's not in your direct backyard, if you want hormonal management, and like people can see my practice and my group that works with me telephonically now, and we can manage hormonal medicine that way. So if you, Dr. Hot Flash, you can find my clinic too. And if people want to talk to us, we're happy to help see patients or guide them. So there's many ways to find folks, but you just need to find the right places, like, and who's going to be doing those kind of things. But unfortunately, it would be great if we had something like psychology.
Right.
I mean, but we don't. It's just too massive. I mean, the sheer numbers of clinicians are tremendous.
So you keep on mentioning the word clinician. So for me, a clinician is somebody who's a licensed social worker, psychologist, marriage and family therapist. And then we have what I term as physicians, which are people who've practiced, family medicine or medicine. So what's your definition? Because I'm hearing clinician. So
yeah. So I usually interchange like clinician or provider, because I recognize that there are MDs and DOs who are the primary physicians. Those are the degrees that you get from medical. You can either be a doctor of osteopathic medicine or a doctor of allopathic medicine. Those are your two biggies. There are also naturopathic physicians. So that's another, so those folks often, they're very integrative. They're trained to be integrative functional medicine kind of clinicians, but they don't have exactly the same authorities with like surgeries and various other things as MDs and DOs, but they're very well qualified in herbal medicine, natural medicine, functional medicine. They can often, quite a few of them do thyroid. They do great thyroid management overall and hormonal management. So naturopathic physicians fall in that place. Then you also have NPs, nurse practitioners, who I think are very well suited for this type of medicine. And even in my practice, at our most number of clinicians, I had 15 of them, and 12 of them were nurse practitioners, but they were all trained by me and under me. And then you have physician assistants who work closely supervised by physicians but they typically go into more surgical professions, but not always. But so I look at kind of clinicians as that whole group there. And then our allied health professionals, and that's where I would lump in psychologists and all this. So it's just it's in some ways semantics, but I'm looking more as clinician as someone has the ability to write and prescribe hormones or various other things.
Gotcha. Okay. Just so everybody's clear too. I'm so glad you broke it down.
It's confusing for a lot of people.
Yes. So you are a DO. Can you give us your medical background? I mean, I know I gave it in the intro, but what makes you qualified?
Well, as osteopathic and allopathic, so MD DOs, they get very similar training. We have same rigor, same board certifications. We can do everything from surgery to cardiology. Yep. So the practice of medicine, really, they're identical. Where they go a little bit different is the osteopathic medicine is really more about a philosophy and an additional training. So osteopaths tend to look at more whole body integration and medicine. That's our tenet of training, where MD allopathic tends to be more segmented. But also when I start thinking about osteopathic, we also get additional training in how body alignment is so important for all body functions. So in other words, we learn, and it equates similar to chiropractic medicine, but it's very much more detailed and more fulfilled in a more broader category. So we get osteopathic manipulation training. So I think this is my personal, and I have lots of wonderful MD colleagues and friends. I just think DOs, we get a little added extra something. And we have a more integrative philosophy just based on our training. So I think DOs are really great primary. They tend to also go more into primary care specialties and tend to be more open-minded. And that, I guess I'm overgeneralizing. Like I said, I have wonderful MD friends who are very open and integrative and all those things, but it's the mindset of the training going in, though.
Yeah, no.
So I did my medical school as an osteopath. Then I did an MD residency in internal medicine, but then I did a fellowship in women's health and spent the next 20 plus years of my career learning everything I could about hormonal health. I had an opportunity for 10 years to work at Procter & Gamble to help them try and launch a testosterone patch for women. And through that experience, I learned a lot about hormones and also got to meet world's leading experts in female sexual health and function, and just soaked up all this knowledge and information that I could, and have wonderful mentors through that process and learning. So it was a godsend. And then I translated it into clinical practice after I left P&G.
Okay. So in other words, ladies, if you ever questioned or doubted her level of expertise, she knows her shit. She knows her shit.
Yeah, I'm not dabbling in this. No. I'm knee deep in, as you say, knee deep in the shit.
Yes, that's right. So what advice would you give us? So me included, what advice? So I'm 42 years old. I gave you a quick rundown of the things that I'm working on. What advice would you give me? So one, obviously, I need to find a new doctor, and I need to find out if you and I can connect privately.
Absolutely.
But what advice would you give me or another woman that's around the same age? Again, 35 to 45 is the general age of our listeners.
So a couple of steps. Number one, trust yourself, trust your body, know if something's wrong. And if you think something's wrong, there probably is. Number two is that oftentimes as we get older, we start to assume that this is our new normal, and we get very stoic about it.
Yeah.
That you do not have to accept being apathetic, or that because I hear this all the time. Oh my God, I have a great husband and great kids. I have money. I've got everything I would want, but why am I unhappy? If you're feeling that apathy, it's likely a testosterone deficiency. I mean, there certainly could be other things going into that, and relationships and various other things, but we're not supposed to get apathetic, dull, and stoic and move through life suffering. So if you're starting to feel that way, question why. And in particular, if it's in your 30s and 40s, because hormones are probably at play there. So not accepting the status quo of the insidious, apathetic kind of nature that just tends to overtake our bodies. And then I would just say, make sure that you take the time for yourself and everything in life, but in particular to seek the answers that you may need, and don't stop until you get them. So.
I love that. And if for any reason, it sounds like if for any reason you feel like you're not being cared for the way you want to be cared for, we got to find another doctor, right?
Trust your instincts. We're often dead on.
So another question, so let's say we're bouncing from doctor to doctor. How do we ensure that our new doctor has all of our information, all of our history?
That's where it's really important. Number one is to always make sure that they do a medical records and get everything transferred. But I'm going to tell you from my own personal experience, I very rarely read those documents myself. Because it just takes, doctors are very busy and trying to get through the day, and to sit down, unless there's some compelling case that's really complex, or I'm doing it as a favor for a friend or a family, I very rarely will go dig in that deep. So what I would encourage people to do is keep your own records. Also try to create little synopses or timelines. And some people think that this is neurotic and crazy, but I don't. I like when people are organized and they can walk in with a couple sheets of paper that says, these are the meds that I'm on. These are my allergies. These are the significant, Reader Digest bullets of things that have happened to you in your medical history, so that I can, within 5 seconds, look at something and get a complete look at somebody's medical history, and use that information usefully instead of having to dig through charts and all those things. Mm-hmm. And also, when people come to see me, any recent blood work is also really helpful, or imaging, or things that they can have. And because people often, we go get these tests done, but they don't ask for their own records, and they're sitting up in cyberspace, and you have no idea what they really said or if everything's okay. And then what if you need that information? You're just assuming everything's okay. Yeah. So make sure you keep copies of your important things, and create a binder. This is a me binder. This is what's happened to me.
Yeah. And that binder is extremely important, so we can go back and, provide information to health professionals. I love that. everything you're saying, it's like, oh my gosh, I'm so thankful we were able to come on. So if somebody does want to work for you, not work for you, work with you. I mean, might want to work for you to pay for you, but let's say if somebody does want to work with you, do we have to be in the same state? Because I mean, you already have a patient right here with me.
Oh, you're so sweet.
Do they have to be in the same state? What does this look like?
So now that there's the current telemedicine laws, and they can change. So right now with COVID, they've kind of taken off some restrictions. So we can often speak to people from any state across the country and get prescriptive authorities and various other things. In an ideal scenario, obviously, we'd love to see somebody at least once a year if we could, and then do telephonic stuff in the middle. But we can manage folks telephonically with certain restrictions based on telephonic laws. Those may change, but for as of right now, we're okay to do a lot of that kind of medical management with appropriate historical things, medical records, labs, and various other things to help guide and drive us. So if folks want to do that, I mean, if you go, my website is actually a host of information and conduit. So it's Dr. Hot Flash, drhotflash.com. And there you'll see at the bottom, it has a link to my clinic where I have practitioners working with me. And then there's also links to my book. And then there's, if medical professionals want to learn more about this type of medicine, I do training. So there's that kind of link there as well. Tons of blogs, articles. So it's a host of information that can help you. And then it's also important to note too, that just one little thing is that there's also an attack going on right now to try to eliminate compounded hormones, and it will disproportionately affect women. So I know we're wrapping up on our time, but I encourage your listeners also to go to a website called compounding.com. And there, it will tell you more about the historical attempts by Big Pharma and the FDA right now to shut down our needs of hormones. So I think it's important that people become educated before it's too late and learn what they can do to intervene and help. And there'll also be more links and information to people in my space of medicine as well. So some of those things will give patients a lot of information to work with.
It sounds like you and I are going to be recording another episode to talk about hormone health.
Absolutely. I would love to, because there's a big attack going on right now, and women are going to be the losers if this goes through. So. Yeah,
I agree. So where can we find you? You gave us your website. Are you on social media? Are you on any other?
Dr. Hot Flash, my social media site. I do have, apparently, this is so bad. I have an Instagram page and I'm a publicist, all those things manage it. I'm a little bit more old school, but typically Facebook, my website again is a lot of conduits. We do a lot of webinars and various other things. You can go to the Hormonal Health Institute, which also has another whole host of information and webinars that people could listen to. And so I've not been very good on my social networking following, my professional, but people like yourself, maybe I could learn more from as well.
I got you. We'll do an even trade. Well, maybe it won't be even.
And it looks like you're doing wonderful retreats too.
Thank you. So a question I often ask all my guests is, what advice would you give to the mom who feels stressed and disconnected?
Oh, then there's so many of them. Unfortunately, as hard as this is to do, you have to disconnect. Even if it's just if you have the ability just to go to a wellness retreat or a spa or something that you can do something for uniquely yourself, or if it's as simple as just going and doing a yoga class by yourself or getting away for a day to go read a book. I mean, you have to disconnect, because if you're not taking care of yourself, you can't properly take care of others. So you need to fill your gas tank, and whatever you can afford in that manner, and whatever looks and feels good to you, do it. Take time for yourself.
I love it. It's so true. It impacts everything. Dr. DeRosa, you have been absolutely amazing. I'm going to keep you on after I hit stop recording, because I have more questions. But thank you so much for coming on. You've given us a wealth of information.
Oh, you're so welcome. Thanks for having me. I love having the opportunity to blab whenever I can.
Absolutely. Absolutely. Many women lose their own identity in the shadow of being a mom and a wife. We are a community of women who support each other. We leave perfectionism behind to become empowered and unapologetic. I want to personally invite you to join our Girl Gang. It's a free Facebook community for women just like you. Go to www.facebook.com/groups/empowered and unapologetic. See you there. What's up, ladies? Just want to let you guys know that your ratings and reviews for this podcast are greatly appreciated. If you love this podcast, please go to iTunes right now, write a review, rate the episode, and subscribe. Don't forget to share it with your friends.
It's easy to blame ourselves for our struggles with alcohol. We see people around us being able to control their drinking without any consequences, yet no matter what we try, we can't seem to figure it out for ourselves. My name is Jillian Teets, and I am the host of the Sober Powered podcast, where I use my biochemistry background to explain the latest research in addiction and help you understand both why you drink the way you do and how to develop the skills and mindset you need to find freedom from alcohol. I discuss topics like why we think about our drinking 24/7, why we have no off switch, and why we crave alcohol. If you're struggling with your drinking or you know someone who is, then I hope that you will check out the Sober Powered podcast. New episodes every Friday. See you there. It's easy to blame ourselves for our struggles with alcohol. We see people around us being able to control their drinking without any consequences, yet no matter what we try, we can't seem to figure it out for ourselves. My name is Jillian Teets, and I am the host of the Sober Powered podcast, where I use my biochemistry background to explain the latest research in addiction and help you understand both why you drink the way you do and how to develop the skills and mindset you need to find freedom from alcohol. I discuss topics like why we think about our drinking 24/7, why we have no off switch, and why we crave alcohol. If you're struggling with your drinking or you know someone who is, then I hope that you will check out the Sober Powered podcast. New episodes every Friday. See you there. It's easy to blame ourselves for our struggles with alcohol. We see people around us being able to control their drinking without any consequences, yet no matter what we try, we can't seem to figure it out for ourselves. My name is Jillian Teets, and I am the host of the Sober Powered podcast, where I use my biochemistry background to explain the latest research in addiction and help you understand both why you drink the way you do and how to develop the skills and mindset you need to find freedom from alcohol. I discuss topics like why we think about our drinking 24/7, why we have no off switch, and why we crave alcohol. If you're struggling with your drinking or you know someone who is, then I hope that you will check out the Sober Powered podcast. New episodes every Friday. See you there.
Hey there. This is Casey McGuire Davidson, host of the Hello Someday podcast. I'm an ex-red wine girl turned life coach who helps busy women change their relationship with alcohol. I spent 20 years climbing the corporate ladder while drinking a bottle of wine a night to unwind. In the Hello Someday podcast, my goal is to teach you the tried and true secrets of creating and living a life you don't want to escape from. Each week, I'll bring you tools, lessons, and conversations to help you drink less and live more. I'll teach you how to navigate our drinking-obsessed culture without a buzz and how to turn the decision to stop drinking from your worst-case scenario to the best decision of your life. You can find new episodes of the Hello Someday podcast every Thursday, wherever you listen, and I hope you check it out.
It's easy to blame ourselves for our struggles with alcohol. We see people around us being able to control their drinking without any consequences, yet no matter what we try, we can't seem to figure it out for ourselves. My name is Jillian Teets, and I am the host of the Sober Powered podcast, where I use my biochemistry background to explain the latest research in addiction and help you understand both why you drink the way you do and how to develop the skills and mindset you need to find freedom from alcohol. I discuss topics like why we think about our drinking 24/7, why we have no off switch, and why we crave alcohol. If you're struggling with your drinking or you know someone who is, then I hope that you will check out the Sober Powered podcast. New episodes every Friday. See you there.
I know we've been taught that motherhood requires alcohol. I know we've been taught not to question our relationship with alcohol until we've lost everything. And I know we've been taught that if we do dare to examine our relationship with alcohol, we need to head straight to AA and declare ourselves an alcoholic who is powerless to alcohol forever. But what if all that isn't true? That's definitely not my story. I'm Suzanne, the host of the Sober Mom Life podcast. I'm an influencer who stopped drinking in January 2020, and since then, I've been telling the truth about motherhood, influencing, alcohol, and sobriety. If you suspect deep down that glass or 3 of wine at night might just be making motherhood harder, well, you're right. Come and join me as I chat with other sober and sober-curious moms. Let's laugh, cry, and normalize sobriety together, all while we reheat our coffee for the 4th time today.
Addiction impacts all of us. Addiction's consequences run through all of us. From ourselves to our loved ones and through our communities, addiction creates so much loss and grief. My name is Dwayne Osterlin, and I'm the host of the Addicted Mind podcast, a show featuring personal stories, expert guests, and vital information about addiction and addiction recovery. We'll talk with leading treatment providers to discuss the latest research and treatment options for this devastating disease and advocate for mental health awareness. We discuss topics like the importance of creating a community of support, to helping loved ones, to some of the latest research on psychedelic medicines. The Addicted Mind podcast has been about creating hope, listening to stories of many amazing people that have overcome addiction and are thriving. If you or a loved one is struggling with addiction, subscribe to the Addicted Mind podcast wherever you get your podcasts, or check out theaddictedmind.com. New episodes every Monday. See you there.